So some technical parts of the traditional facelift. I think this is very important to understand because what you lift determines the result you get and, more importantly, how long it lasts. So in a nutshell, think of your face like an onion. You generally have three important layers that sit upon a fourth layer, which is your facial skeleton. And in between each of these layers is kind of a thin, wispy layer. So, layer one, the first layer of the onion, is your skin. Second layer below that is something that is where your facial muscles are, and some thick fibrous tissue that connects all the facial muscles together, which we call the SMAS. SMAS stands for, in medicalese, superficial muscular aponeurotic system, but commonly known as SMAS or S-MAS. And that's a very important layer, which I'm going to touch on in a second. The next layer down is a layer that covers some of the glands and deeper muscles of your face. And this layer is very important because this is the danger layer. This is where the nerves that control your facial movement go. And it's very important that the surgeon have a very good working knowledge of this anatomy because it's very easy to get into the wrong layer. Finally, I think there is the deepest layer, which is the tissue that's covering the bone. And there's actually many surgeons that actually do lifts down in this layer. It's called a subperiosteal facelift. And I think all of these lifts have advantages and disadvantages, but I think for all of them, if the surgeon respects the layers of the face and the underlying anatomy of each of these layers, we can really tailor make the proper type of lift that will meet the needs of the patient. So most of the lifts are in that second layer, the SMAS layer. And the reason we like to do lifts in this layer and not just in the skin, which is the way many people lift the face, is that, guess what? Skin stretches. Ask any pregnant woman. Ask anybody who's gained weight. Skin just stretches. So if you're relying on the skin to hold your face up, it's going to look great for a short period of time, but just like what happens anywhere else, the skin will stretch and it will drop. And often, sometimes, the scars will start to stretch too and become more noticeable. So we kind of reject skin-only lifts. We don't think that they last and actually create more problems than they help. Again, some people will say, hey, we can do this for half price, we can do it under local anesthetic. But like many things in life, it's great in the short term and not so great in the long term. The SMAS lift is really good, and it's actually the most common lift, I believe, done in the world, because the SMAS layer has some oomph, it has some holding power. And when you lift that layer, that's when you get 10-year results. And so the way we do it is we lift the SMAS layer and the overlying skin layer just comes along for the ride. And so it's kind of a composite flap or a multi-flap lift. And that's important because, of course, the skin lifting is what people are going to see. The SMAS layer not only gives holding power, but it brings up underlying structures too to make your face look natural. That way, some of the fat layers and some of the other tissues of the face that have fallen with the SMAS get lifted back up, and this goes back to making the face look natural while also making it look rejuvenated and lifted. Again, that third layer, danger layer, it's important to know the anatomy of this layer. My training as a head and neck surgeon, we do surgery in this layer all the time. We have to find the facial nerve for trauma. We have to find the facial nerve for tumors. Well, when we do a facelift, I know exactly where all that stuff is, so I know exactly what to stay away from. Sometimes it's important to have a working knowledge of where you need to be and where you don't need to be. One of the other advantages of working with the layers of the face is blood vessels kind of run within layers. They generally don't run up and down between layers. And why is that important? If you respect the layers of the face, you have very minimal bleeding and bruising. This is why we generally don't need drains for our facelifts, and our patients have very minimal swelling and bruising and have very, very quick recovery. It's respect for the tissue planes and handling the tissue carefully in a precise manner that helps us almost always get an excellent result. So although this may sound a little esoteric or medical or whatnot, I think what it underscores is a working knowledge of the anatomy equals excellent results for the patient, excellent recovery, and less likelihood of complications.